Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 14 new cases of COVID-19 in Windsor and Essex County. 12 are close contacts of confirmed cases, 1 is community acquired, and 1 case is still being investigated. We have had 16,572 cases since the beginning of the pandemic. 202 people are active at this time, with 115 of our active cases being a variant of concern. To date, 1,798 preliminary or confirmed variants have been identified in Windsor-Essex County, with 1,661 cases being the UK variant, 4 cases the South African variant, 5 the Brazilian variant, and 2 are the B1617. 12 people are currently in the hospital and 5 people are in ICU. We are sorry to be reporting an additional death today. A man in his 70s from the community has passed away. Our community has now lost 427 people to COVID. There are currently 10 active outbreaks in Windsor and Essex County, 9 workplaces, and 1 community outbreak. Regarding the vaccine rollout, 275,361 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 247,613 people have received at least 1 dose. Overall, 70.8% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment at one of our mass vaccination sites. In addition, seniors 80 years of age and older are now able to book their second dose appointments. Family and friends, please help your loved ones book their second dose appointments. You do not have to book at the same site that you received your first dose. Please call 226-773-2200 to book an appointment or visit wevax.ca. People are also able to receive their first dose of a vaccine at a participating pharmacy or primary care provider. Select pharmacies are offering second doses of AstraZeneca to those people who received their first dose between March 10th and the 19th. Our health unit will be delivering an additional 3,170 doses of AstraZeneca in the next couple of days. Today, we will be hosting a pop-up clinic at the Atlas Tube Recreation Center in Lakeshore from noon until 7 p.m. Youth 12 to 17 years of age and their household members that are over 18 years will be able to receive a first dose of a COVID vaccine. On Thursday, June 3rd, another pop-up clinic will be held for youth and their families at the Essex Centre Sports Complex in Essex. We have invited our board chair to attend this morning to provide an important announcement. I will now turn it over to board chair of the Windsor-Essex County Health Unit, Gary McNamara.
All right, thank you very much, Teresa, and those who are obviously viewing from comforts at home. As board chair today, as you are well aware, that at the end of this month, our current CEO, Teresa Marantet, will be retiring as of June 30th of this year. With an exhaustive process, and very quickly done, I'm very, very pleased to say that we are now ready to announce the new CEO of the health unit, and it's Nicole Dupuy. Nicole, as we all know, is one of our long-serving directors of health protection, and she will assume the role of Chief Executive Officer for the Windsor-Essex County Health Unit effective July 1st of 2021. Nicole is well known to our health unit and certainly to all of our community partners as, again, the Director of Health Promotion, and has been a valued member of the senior leadership team since January of 2014. She is well respected for her knowledge and expertise in public health and has been an instrumental help and right hand to obviously both to Teresa and Dr. Ahmed during the last 14 or 15 months in serving our community on the pandemic. So with that, it gives me certainly great pleasure to introduce Nicole as our incoming CEO as of July 1st of this year.
Okay, so thanks, Gary, and I'll have lots to say about Teresa when the time comes, so I'll just save those comments for later.
Yeah, and I certainly want to, I'd be certainly remiss, and we, you know, these have been, as many of us have understood, unprecedented times, not only you know, across the country and in the province and the world, but certainly in our own community here, dealing with this pandemic. And as board chair and member of the board, we are indebted to the strong leadership of certainly Teresa over the last 14 months, and you know, guiding with Dr. Ahmed and the senior management team. This, you know, this pandemic. And when we look at our region today, although the announcement was made today where we did lose another one of our community folks, but when we look at our position, certainly in the province and certainly in the country, we are in a better way than certainly what we were at the beginning. From the onset of putting a lot of measures in place, it has not been an easy task. The pressure has been insurmountable for many. As you know, there hasn't been a day in the last 14 months that certainly Teresa has not been, you know, at the forefront, taking interviews and organizing, you know, clinics and organizing the community to best prepare itself. So these are big shoes to fill, but certainly Nicole, I think there's no doubt is up to the task. But certainly the community, we owe you, Teresa, a thank you, a huge thank you for your leadership, your professionalism in dealing with a once in a lifetime issue. So congratulations on certainly on your retirement, and for God's sake, get some rest, if anything. And you're leaving the health unit, you know, with a strong mandate to continue to serve, you know, our community in a safe, efficient manner, and we will get through this. We're seeing daylight, and a lot of it is through your guidance and certainly your leadership. So, on behalf of the board and every citizen in our community and all of our stakeholders, we wish you all the best in your retirement. Thank you for your service to your community for so many years. Over to you, Dr. Ahmed.
Thanks, Gary. Thanks for those nice words. I think you've said it very nicely, and I don't have much to add. So we'll just go directly to the questions that our reports might have.
Okay, we'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Dr. Teresa and Mayor McNamara. First, I just wanted to ask, do you know how many second dose appointments were booked yesterday?
So Taylor, we don't have the exact number because we just track by the number of appointments that are available and open, rather than looking at how many of those appointments are booked for second doses. We will be able to share the number of second doses that are given once we start giving out these vaccine into the arms of the people. So we'll have more data to share with the actual data rather than just the appointment. But as of yesterday, when we were looking at it, there were some sites such as Leamington and downtown. There were some openings available as of Wednesday and Thursday. So there are open spots available in some of the clinics, maybe not all. But looking forward, if needed, we'll continue to open up more clinic, but we want to make sure that we offer it to everyone that if they have a site available, if there is an opening available, go and get your vaccine right from there.
Are you able to comment? Was there good uptake yesterday? I know there were technical difficulties in the morning, but at one point I was giving it a shot and I was something like 3,000th in line.
So I'll comment on that. Yes, there was a very good uptake yesterday, and at one point, I think I was told that there were 2,200 interactions on our website in 1 minute. And so I know that we have heard people had to wait for some booking, to book, and also at the call center. But by the afternoon, things had improved a little bit. So we encourage people to continue to book. We know that there is a little bit of a waiting period at times, but as Dr. Ahmed said, there are some available appointments, and we'll open up additional appointments as we see everything get filled up. But yeah, yesterday there were a few glitches and long waits, but overall the message seemed to be out there and people are booking.
Thank you. I'll let my colleagues tackle some other topics.
Any questions from AM 800?
Good morning, everyone. I'm just wondering, either for Teresa or Dr. Ahmed, the province has now mandated immunization policies for long-term care homes. And I'm just wondering, in terms of our long-term care homes in Windsor-Essex, were there already policies in place, or will you now have to assist in putting these new policies into place?
So there were no policies in place specific for these type of vaccination. Even flu vaccination, it was not mandatory. So what we are seeing is something that's new, but something that would be helpful for keeping these long-term care home and retirement homes safe. So we're looking forward to it, and we're hoping that most, if not all, will get their vaccine and will keep their part, and will keep these facilities safe for everyone.
I remember I had asked, I think it was late last week, about the number of employees at the homes that are vaccinated. And Teresa, you had mentioned that a lot of them are, but not all employees are vaccinated. So now that homes will have to track and report back on their progress, will they be reporting all of that information to the health unit, or will that go directly to the ministry?
Yeah, so it will go back to the ministry, not to us. We'll be tracking that information as well, but these information are directly reported back to the ministry, even for the current vaccination rate that they are doing. So we have access to the information, but we are not the one who requires that or who mandates that. That's the ministry, but we work very closely with the long-term care home and the ministry to make sure that we are providing the public health expertise and public health support to all of these facilities.
And the province is saying that staff must provide proof of vaccination or a documented medical exemption. So what would qualify as a medical exemption if someone didn't want to get the vaccine?
Well, generally speaking, there are very few medical exemptions that we are talking about. It has to be either some kind of a severe allergic reaction to the component of the vaccine that could result in an anaphylactic shock or something, or if there is any kind of current medical treatment that would prevent these people from getting the vaccine right away. But these are very few medical exemption specific to the vaccine. That are out there. Almost every individual can get a vaccine safely. It's not a question of having medical contraindication where there are very limited medical contraindication for the vaccine. For the most part, everyone can get the vaccine.
Are you expecting any pushback on this? Because the provincial government has basically said since the beginning of this that they can't force anyone to get a vaccine, but now it is becoming mandatory. So are you expecting any pushback at all?
Well, when I'm looking at the number of our coverage rate, if it's low, then that means there are people who are not getting the vaccine in some of these facilities. So those who are not getting the vaccine, they may have reasons why they're not getting the vaccine. And if they are the one who want to push back, they will. But as I said, it is the right thing to do. There are very few medical contraindication to not to receive the vaccine. So I would encourage everyone to receive the vaccine, to get the vaccine, to make sure that they are safe and they're keeping everyone safe.
Okay, thank you.
Any questions from CTV?
Yeah, so just to clarify on that, you don't have any data, any figures, any numbers you can give us about the number of workers who have been vaccinated in long-term care homes at this time?
We do have the data, but we would encourage you to connect with these facilities because, again, those data are for our internal use, mainly for the vaccination coverage rate, especially when we're talking about the staff rates. And a lot of that data, it's I would suggest that you connect with the facility and or the Ministry of Health or Ministry of Long-Term Care, I should say.
Okay. We know today at noon the National Advisory Committee is going to be making the recommendation that AstraZeneca can be mixed with Pfizer and Moderna, and then both Pfizer and Moderna can be mixed as well. Is this something that we are going to roll out locally as well?
Well, definitely, we are looking for the specific guidance. While it's preferred that when you're getting the first dose of the vaccine, you get the same dose of the vaccine, but there are some exceptional circumstances, which could be like the non-availability of the vaccine or allergy to any specific component of the vaccine, or the just the sheer shortage of the one vaccine versus the other. So there are some circumstances. We use these mixing of other vaccines in other type of vaccine that we use. So it's not entirely unusual to do that. We just want to make sure that it's done safely and it is generating the right immune response that we are looking. So there will be more specific guidance on that, but once that guidance is out, obviously the province will adopt those guidance. And once the province will adopt those guidance, we'll be the one implementing it locally. And that would definitely give people more choices and more options.
Okay, so you guys still prefer, at this time, you guys are going to be promoting, still get the same brand that you initially got with your first dose?
Well, as I said, we have to rely on some information and some regulatory bodies and their recommendations. These vaccines are approved for a specific type of use by Health Canada, and it's also supported by NACI, so we need some of those recommendations, especially when we are making any kind of policy decision. As a clinician myself, if I have a patient and if I want to provide or prescribe any treatment that is based on good research, but not necessarily as a guidance from local bodies, I can still go ahead and do that. But any kind of policy decision that we're talking about, whether regionally or provincially, it has to be solid based on some clear regulations and regulatory authorities that each one of us have to roll it out. So for a population level impact, I would wait for the direction from Health Canada, NACI, and then our local provincial authorities.
Okay. We know obviously the stay-at-home order ends tonight. Can you clarify for our viewers what that means? What can they do and still what can they not do during this time until we hit the June 14th stage 1 phase, hopefully?
Well, I think there's not a lot of difference because the Premier did make some announcement last week when we went ahead with some of the relaxation of rules with the outdoor gathering and outdoor space use, and the the most important impact that it would have, that we will no longer have a stay-at-home order. So people can go outside and outdoor for non-essential reason, and that will be the significant change. Other than that, everything else will pretty much stay the same until we get to the June 14 point, when we will see further relaxation of some of these gathering and some of these restrictions eased in businesses as well as outdoor activities.
We still have a lot of restaurant owners that are obviously speaking out, very frustrated that they still have to wait to open up. Do you have any messages for them at this time?
Well, all I can say is, I get it. We're all frustrated, each one of us. It's been more than a year and a half, and even though, I come here, I talk to all of you, there are part of me and part of my team who also want to go back to normal, who also want to do the same thing that we used to do before. So it's not something that anyone likes. So we definitely want to open up. We want to do things, but we want to make sure that it's done safely. And right now, I think it's the timing can be interpreted differently in terms of who is saying what is safe right now versus what will be safe 2 weeks from now. But the Premier has given us a timeline and a roadmap that what the opening would look like, that would help people to at least plan ahead and prepare for opening when things starts to open up.
Okay, and just for clarification as well, I know technically according to the Healthcare Consent Act, there is no minimum age to provide consent for vaccination. Do children here need a parent or guardian with them if they go to a clinic to get the vaccine?
So you're right from the Healthcare Consent Act perspective that there is no age of consent. We have to make sure that the person or child is capable of understanding what treatment that is offered to them, what are risks and benefits of them, and sometimes it's a subjective assessment of it. So maybe even like a 15-year-old can have that understanding, and another 15-year-old may not have that understanding. So that's why we recommend that, especially children, they should have a discussion with their parents, or parents should have a discussion with their children, and they should both come together to get the vaccine, to get the vaccine, to help them understand. It's not a requirement, but we want it to have a dialogue. We want to make sure that everyone understands, everyone is on the same page, and if there is any confusion or clarification that is needed, we can provide that, and that's the intent. But short answer, no, they don't need that parental consent if they are able to understand the procedure and the risk and benefit of it.
Okay, thank you.
Any questions from CBC?
No, not today. All my questions were asked and answered. Thank you.
Any questions from Blackburn?
No, thank you. Same asked and answered. Thanks.
Any questions from CFTV?
Hi, yes, good morning, everyone. My question has to do with beach water testing. With beaches being open, how is your lake water testing being done?
So we did our initial testing yesterday. Typically it takes 48 hours for us to get the results back. So we'll probably have our results back sometime tomorrow, and we'll post the finding on our website, and we'll continue the process twice a week, and then we'll continue to report back throughout the summer.
Now, if the beach level is, if the beach is unsafe for swimming, is that water retested that same week, or is it retested again the following week?
So it is, when I said the water is tested twice a week, so that means, we're testing it, I think, once on Monday, and the other one is Wednesday or Thursday. I forgot the exact timeline. But then even if the water sample is unsafe for swimming, another retest would give us an idea of what the water contamination looks like. And then we do some modeling as well to better prepare and understand what the situation would look like for each of these beaches. But there are a number of factors that go into the coliform count when we are looking at the beach water testing. It depends on the rain, it depends on the temperature, and it depends on the movement of the water as well. So there are a number of factors that go into it. So this is a guidance that is provided. It can never be an accurate up to the time of assessment. If you're using the beach, you will not have the data as accurate for that timeline. It will always be a report that was 1 or 2 days behind to assess the beach water quality.
Thank you so much. And one more question. How easily is it to contract COVID when you're swimming in the lake? Is that something that is easily to transmit through the water?
Great question. I don't think that there is any evidence that it could happen that way. In theory, let's say if someone who is sick, if they're swimming in the water and then the water is going through their nasopharynx or nose and mouth, and then if it's coming back with some potential viral contaminant, and then theoretically it goes into someone else's body. So I don't think that there are a lot of plausible reasons for that to happen. So I haven't seen any data, any recommendation about not swimming in the water because of that. But those are something that we still don't know. But at this time, I wouldn't change my recommendation. If people want to go and enjoy the swimming in the lake, they can. But like always, do it safely.
Thank you so much.
Any additional questions from the Windsor Star?
Yes, Teresa, can you share your thoughts? How are you feeling about passing on the reins to Nicole?
Well, I feel really good about it. Nicole and I have worked together for the past 7.5 years. We were directors together. We've worked closely together. She's not only an amazing colleague, but she's a great friend. And I think the health unit and the community are in good hands with Nicole. She is well known in our community, and I have a lot of respect for Nicole. So I feel good about the outcome of the search, and I'm very happy for her, and I think she'll do a great job.
Thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
Teresa, sorry, can you just give us a quick breakdown of your history? How long have you been with the health unit again for?
I've been with the health unit. I was hired in October of 1989, and at that time I was still working at Grace Hospital in neonatal intensive care. So I kind of actually did both jobs for a while. But overall, I've been at the health unit for the past 30 years and essentially worked every nursing job in every department. I really moved around a lot. I explored every opportunity and then went into management in the year 2000. Became a manager across different programs, then a director, and then CEO. But my background is nursing, and when I do have a moment to think about it all, I'm really, it's been a great career, and especially these past 15 months, it's been just incredible to be part of a global pandemic and to support our community. I guess that's it.
Okay, congratulations on your retirement.
Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Thank you.
Any additional questions from CFTV?
No, thank you.
Okay, thank you everyone. Have a great day.